midwife.
Thank you. Okay, good morning once again, lovely viewers. And as she rightly said, my name is Wasa Kodie. And today we are going to talk about exclusive breastfeeding. So when we say exclusive breastfeeding is breastfeeding the baby exclusively with breast milk for 6 months without any baby supplementation or baby foods, but for drugs prescribed by the physician.
Yes, and you see, with the medication that she was saying, you see, within the first 6 months, your baby is prone to anything. As much as she's come to educate us some of the importance of the breast milk, which we have immunity as part of it. You know, we can't prevent our ward from getting feverish and other things. So with that, you are permitted to administer a drug, but that, please, not over the counter, I beg you. Because this is a child who is now forming organs, and the organs are not fully mature. Yes, so it is strictly prescribed by the physician. That's why you can add medication. So if you still add medication, it is still exclusive breastfeeding. Alright, so now she'll take us through the types of breastfeeding and then how they are done.
Okay, so we are going to talk about the types of exclusive breastfeeding. So we have 3 types of exclusive breastfeeding, and the first type is when the baby is breastfed directly from the mother's breast. That is, from mother to baby directly. And we have the second type when you breastfeed from the breast to the baby, and sometimes you also express into a bottle for 1 or 2 reasons. And the third type is when the breast milk is always expressed into a bottle.
Alright, and I think with the being expressed, it mostly work for the career women, because you have most people who are coming for maternity leave like 3 months. Some have even less, and then they would have to go to work and then come back. So I would prefer the direct one, because when you're breastfeeding your word directly from the breast, it establishes this mother-child relationship. You see, because you look right into the baby's eyes, and she knows this is my mom, this is my mother.
Yes, and sometimes there is interaction with you and the child.
Yes,
It
and
really
it
helps.
really helps.
So for career women, you can go for the second type. That is when you breastfeed from the breast to the baby when you are at home, and then you express when you are going to work.
Alright, so that is with the types of breastfeeding. Now, you know, everything have its importance, right? Yes. So as much as we know exclusive breastfeeding is to the child, a mother as a nursing mother that does the exclusive breastfeeding also gets a benefit. So let's look at that of the mother, then we come to the child.
Okay, so we're going to talk about the benefits of exclusive breastfeeding to the mother. How does the mother benefit from exclusive breastfeeding? Now, we are saying that exclusive breastfeeding helps in uterine evolution. When we say uterine evolution, it means it helps the uterus go back to its non-pregnant state. That is, when you are pregnant, the uterus would have to stretch in order to be able to accommodate the growing fetus, the placenta, and other products of conception, like the liquor and stuff, you understand? So when you give birth and expel the products of conception, the uterus would have to go back to its non-pregnant state. When you are breastfeeding, there is a hormone that is produced that is called the oxytocin, and this hormone is produced from the posterior pituitary gland. And this hormone would help in contraction of the uterus, so that the uterus would be able to evolve and go back to its non-pregnant state.
Alright, again, I heard it have a family planning method.
Oh yeah, it does. Yes. You see, when you breastfeed, okay, prolactin levels are raised in the body. And once prolactin levels are raised, progesterone and then estrogen levels are reduced. And these progesterone and estrogen hormones are the hormones responsible for ovulation and then menstruation. So once they are reduced, it means menstruation and ovulation after delivery would be delayed. And this would delay your next pregnancy, because you are not going to ovulate or menstruate anytime soon. And this can even be achieved when breastfeeding is done at night, because prolactin levels are raised during the night.
So during the day, when the baby is asleep, you're also supposed to go to bed so that you can have more time during the night to
breastfeed the baby.
Okay. Do we think it have any economic value?
Oh yeah, it does, because these days baby foods are very, very expensive. So if you want to breastfeed baby and then you would supplements with baby food. You have to buy lactogen and this nan and stuff, these baby formulas which are very expensive. But then when you, the mother, you eat very well so that you get enough breast milk to give to the baby, it's going to save you money from buying this nan and then lactogen and these baby formulas.
And it also does not even get spoiled, the breast milk. Yes. But with these formulas, sometimes you have to even reheat or prepare these formulas. But the breast milk, immediately the baby is
already rich from.
Yes. It is already just.
Alright, that is so interesting. Alright, so you see, you as a nursing mother, if you are not practicing exclusive breastfeeding, you are causing harm to yourself. You see. And then I learned it also reduces the mother's risk of getting breast cancer.
Oh yeah, research has shown that breastfeeding reduces the mother's risk of getting breast cancer.
Okay. So now let's look at the importance to the child. Because as much as we are concerned about the mother, the child is our main focus. So let's look at the importance to the child.
Okay, so for the child, it has so many importance, but we're going to talk about a few today. So breastfeeding helps in immunizing the child. So this is a natural form of immunization, straight from God. Yes. This immunization, you see, during the first 3 days, the breast milk produced is called colostrum, and it's very yellowish in color and contains high level of vitamin A, which helps in eyesight development of the baby. And it also raises the IQ of the baby. It makes the baby very, very intelligent. Yeah, and it's going to prevent certain I don't know how to say, but then you see when you start supplementing with baby food, the baby is prone to diarrhea and other stuff.
Or constipation.
So when you give the baby the breast milk, I mean, it has been designed in a way that it is going to it is very favorable for the baby.
And it's also easily digested.
Yes. You see, when the baby comes out, the baby has the stomach like that of a cherry, very small. So the breast milk is enough to satisfy the baby. The only reason why we think the breast milk is not enough to satisfy the baby is because we don't do it very well. You know, when you're breastfeeding and you're doing exclusive breastfeeding, or you want to do it very well, you empty one breast completely. You know, from the first 3 days, you have 3 types: the colostrum, the fore, and the hind milk, and the breast milk. And after the 3 days, we get the fore milk and the hind milk. You want to give the baby the breast milk very well. You empty one breast completely, as I initially said. You give this breast to the baby or that one to the baby, whichever you prefer. You give the fore milk and the hind milk. You make sure this breast is emptied completely before you go to the other side. You don't say this is water and this is food. I don't know where that protection is coming from.
Because they contain water, protein, there's
all the
carbohydrates,
vitamin
there is
the
fat,
baby needs.
there are minerals in it. So we have the phosphorus, the magnesium, the potassium, and the sodium in it with the vitamins.
So, and it's so surprising you witness your mom telling your elder sister to express that milk away. That is the colostrum.
Oh, and yet, no, it's very good. Yeah.
So surprising.
Yeah.
Okay, so that is important to the child. You know, as much as we all like you, I know every health professional would like you to practice exclusive breastfeeding. There is a question mark to say. So there are some people that they cannot really do exactly what we are saying for the 6 months. But you know, health workers, God has given us talent. We are doing our best. So with these people, even though they cannot do the 6 months, there are other ways to do it. So let's listen to that. So Ella, I have a question for us.
Oh, okay. So like the HIV patients, they can breastfeed the child, but only for 4 months, because there are medications that they are taking in. And we also know that the medications that they are taking can be extracted through the breast milk, extracted to the baby. So for the HIV patients, they only breastfeed for 4 months. Yes.
And then you supplement with baby food afterwards to prevent the baby from
Contracting.
And you'll be thinking, if the mother breastfeed, then it means the virus will be handed down to the child. But you know, all this mother is done to, you have the mother being immunized against it for that very time, so that the baby wouldn't have the virus traveling to the breast milk.
And this immunization only lasts for the 4 months. That's where the baby can get, the virus can get to the baby. So after 4 months, we beg you, please don't give the breast milk to the baby.
Please.
Even with the breast milk, it even makes the baby's immune system very strong.
Yeah.
Because they are antibodies in the breast which also fight against
These
infection.
antibodies we are talking about, they are in the colostrum.
Yes.
So don't express them out.
Please. And then again, I learned when you have some lesions, some rashes on the
Oh
breast.
yeah, you don't give it. You see, when you have lesions, some rashes, we don't know what is causing that.
Yes.
It might be harmful to the
Yes.
baby because the
And-
baby has compromised immunity
Yes.
at that time. So you give the one without the lesion or whatever because they all contain the same.
And even with the rashes, if the mother sees that, the mother is supposed to report to the
Health facilities.
yes immediately.
So that something can be. Don't say this one, it's nothing. No. You bring it to the hospital.
You're not even
it's
supposed
nothing.
to prescribe medications
No.
first, so we have to see.
Wow. But they is so revealing. A lot.
And before we forget, people taking TB drugs
Yes,
are also
TB
not
drugs.
supposed to take the.
Do exclusive breastfeeding for 6 months. Wow. There are a lot I didn't really know, and I've learned a lot today. I hope you are also learning a lot. Please, if you have any question, you want an explanation or something, kindly comment, and then we are going to look to that. But before we go, I want to teach you a song that will teach you the importance of exclusive breastfeeding. Hello, Clarissa here.
Oh yeah, I got my turn now.
All right, so shall we?
Okay.
Banunu fusio, riti dao beono, diko sibu sumisia, enfe bianca ho, mao banunu fusio, riti dao beono, diko sibu sumisia, enfe bianca ho, nu fusio titia ontem, nu fusio mekrenyansa, nu fusio ya mo friend ya, enye papa no dia. Wow, this was so interesting. Thank you so much for following and subscribing to our page and liking it, but we still need you to do more. So please share the link, tell your friends about it, and let them subscribe. So you can do this by subscribing to my YouTube channel, that is Magico's Health Hub. You can do same on Instagram, that is Magico, the Magico's Health Hub on TikTok. Thank you very much. And the next video, we'll continue with breastfeeding by another aspect of it. Yes, so we'll teach you some breastfeeding positions. Sometimes the mother when you're in the car.
You had the football hold.
No, don't tell them. Let's just wear their appetite for that.
Yes.
Yeah, so
We
please
also
come and
talk about the care of the breast.
yes, we'll talk about the care of the breast. So please make it a point to meet us another time. Thank you. Then see you another day. Bye-bye.
Ciao.